Hey, my name is Una and I'm about to learn how to use the level 1 infuser and a Ranger for those emergency deliveries where we need to give mums extra fluid.
Find the level 1 infuser behind OR3 in the core. On the infuser, you should see a box that has your tubing set for the level 1. On the back, you'll see instructions for how to connect it to the machine. In the box, you'll find your tubing with the blood set, your long tube, and then the part that goes to the patient. Connect the long tube to the machine, press it in firmly, and attach the top lever. Connect the shorter tube to the bottom port. Press it in firmly again. If you already have blood running, you can attach it to the tube set. You just have to disconnect it at the top. The door has a little hook to hang your blood products on. And once you do that, you can close the door. Prime both sides of the lines. When you're ready to prime the rest of the line, make sure the machine is on and that you have a line that's unclamped. This is what your setup will look like once you have it all put together. At the top, you'll see positive and negative signs. To run that bag, you would switch it to the positive. To stop it, switch it to the negative. When the first bag is empty, turn the top to the negative, and then switch the other bag to the positive to start infusing that line. While this second bag is infusing, you can switch out to your first bag.
Hi everyone. So we are going to quickly review the Ranger. This is the IV warming device we have in the main ORs, and they need a couple pieces of equipment to run through to get the heating of the IV fluid going. So we have up on the top shelf, there is this that has to be received. And then we also usually, if we're setting up a Ranger, I shouldn't say it every time, but most times we're thinking there could be some bleeding, so we want to get a blood set as well. And it has the two lines that we can use. So we're also going to bring in a bag of IV fluid for this. And this is what we need for this, and we're going to go into the main OR and set this up. So, Ranger's here. You want to make sure it's plugged in and turns on. There's a button on the side here. Close off both of them until you choose which one you want to use. All of this unraveled, because we want to have this full of fluid. So you hold it upside down. So what we're going to do here, open it up, comes through the filter, and it starts to fill this all up with fluid, because this is the filter we use for giving blood products. This is used to squeeze to get it in faster, and then once it's full, you just let it down like this, and you have come out the end here, so it's filled there. So I turn it off here, or you can turn it here. Okay, so the next thing we want to do is get this into here. You can already see this is heated up to 40. Slide it in. And make sure the writing's on the top. It's not going in upside down. It goes in all the way. So there's two parts to this that just went into the Ranger. You see this part here, this is the part that goes into the side holder right there. Goes into the side holder. The blood set attaches up to the inside, the in port here. So it comes off here, attached here, and now you start flushing it through. So you open up whatever you closed, and then it starts to flow through. What I do want to point out is that you also don't want air in this. So I have this going, and there it starts to come through. You fill it up, turn it over, it'll come out this end. You can see it drip, and then you sort of have to turn it off because it really comes through easily here. And then you hook this up to the IV in the patient, and it's ready. So it's going through all of this, inside, out, coming through here, and then you can always add an extension if the patient is too far away, or but we have extension tubing in the bottom drawer or in the core. But that is where you get your warm fluid, and we can feel it's already warm. It's 42 degrees situation. If we need to get blood in quickly, like 4 units in a minute, level 1. If we are going to be getting a unit in, but then we're waiting for more blood, or we just even have to do some volume resuscitation, not blood even, Ranger. So once again, if you have any questions, just ask me or ask any of the anesthetists